We are live now, huh? Hi, Dr. Divakar,
Hello, sir.
and congratulations, first of all, for scoring such good marks. And introduce yourself as such, which college you have done it, and all that.
Thank you so much, sir, for your wishes. I'm Dr. Divakar. I joined my MBBS in Ukraine in 2018. Due to some war circumstances, I was transferred to Russia, and I was graduated from Russia Mari State University in
Oh,
June 2024.
okay, okay. So basically, matlab, you have had two wars, huh? One that and one of this passing. So you
Yes,
have
sir. Kind
successfully
of.
conquered up this also, and now today Trump is also coming. So that
Yes,
war
sir.
will also end, I suppose so. Huh?
Yes, sir.
Yeah.
Kind of
So
like.
coming back to this, congratulations to you. And what about your friends who could not able to make it, or those who are going to give up, this particular exam in the 6 months? Like, what's your say about this? How to start up, and obviously you have to start up as soon as possible. What sort of paper it was, and what's your kind advice to those?
Yeah, first of all, congratulations for everyone who did it. And for everyone who can't make it this time, don't worry, don't make disheartened. Everyone can do it. Don't worry, you have their own time, but you will do it for sure. Don't worry and don't give up. This is just one exam. Just you need to clear it. So even if you got like disheartened by seeing the results, don't worry at all. Uh, I can say just to see see analyze your score like where you lack, like the preparation for 6 months, right? So you just to think in which subjects you are like you feeling like you are weak, and why this time you are not able to got it. So just think in that way, and try to change the way that what you did for the past time. Just analyze the past thing and just take it for the future in a better way, so that everyone can do it. Don't worry, like everyone can do it, and for sure you will everyone will do it, sir.
Tell me something about the paper pattern. Like, it's going more clinical now.
Yeah, sir.
Okay, so what
Actually,
do you on that?
yeah, sir. Actually, for me also, like from all other students, for me, paper one was like a bit difficult, like comparing paper two. Like we know, like paper one is like more of clinic, like basic questions, but this time paper one is like more of clinical questions. Like we can't directly go for basic questions, right? So like they
Hmm.
are mixing up the subjects. Like we need to know the proper like 90 subjects. If you know means you can able to tackle. Like if you
Hmm.
just like for example, if you know only physiology, I think it's like based upon this paper, it's not going to help you. You know some medicine with physiology, so that you can able to correlate and you can get answers. So this time
Right.
they played a major role, sir. Paper
And the
two was
biochemistry came in which way? Like, it's with clinical or what? Direct forwards, or what? What sort of biochemistry came
like,
this time?
yes, so like comparing all the subjects, like mostly like all our basic subjects, preclinical subjects, like this time they gave like a clinical, not like some questions are there like for directly based direct questions, like what is the enzyme, what is the coenzyme, like that. But mostly like each and every question they gave like a clinical, like history, questions. So we need to know like why it's
Is
happening.
basically there is not much differentiation between first and second. All is
Yes, sir.
basically linearly correlated this time. You know?
Yes, sir. Yes, sir.
So that is what is the take. And what about pathology? They were telling this time histology images and all they came directly. So
Yeah, sir. This time they gave like for some like they just without giving any history, like they just say identify the image, identify the tissue, like identify the organ. Like some
okay.
questions are there, direct pathology questions, and like
Mm-hmm.
without mentioning any history and all. Like we can't. We need to know. I advise everyone to go for the images, because I think this time images played a major role, even in a
Okay.
basic subject, even in clinical subjects, even for gynecology also. They are not even giving history. They're just giving the picture and they're saying find what is the disease, like find what is the place, like that.
Okay. The images really played a role, huh?
Images are like really played a very role, sir.
And what about pharma and all? Like you were
Yeah, like
telling, it was also clinical related this time.
yeah, like I mentioned before, we know like for one example, I need to say we know like previous year questions are also there. Previous year topics, more of previous year questions, previous year topics are there. But this time, how they like change the questions, like for example, if I need to say like for we know like for mountain sickness there is a drug called acetazolamide.
Yeah.
So we know like most of the students know that the drug is acetazolamide. But this time they are not asking the acetazolamide. Like like they also know that, like we all know acetylcholine, but this time they just give the history of mountain sickness, something like that, and they just give the reference images, and they're asking where the acetylcholine is acting, just to say the place where it's acting. And this time, like pharmacology is like more of mechanism of actions. So they're asking more of side effects, more of mechanism of actions.
Again,
Like
conceptual basically.
yeah, more concept. Like I think for so many like 3 to 4 questions, they directly asked what is the mechanism of action, why we are giving this drug, and how it's acting on enzyme level. Like
Hmm.
that more clinical basis.
Okay. And what's your take on this? Like all 19 subjects should be covered, because some they say that we can leave 3, 4 subjects and we can go and all that. So what's your take on that?
Yeah, even I also, like when I'm preparing, even I also get so much of videos, like watch so many videos, like people are saying so much things. But in my point of view, like yeah, it's for some people. I'm not saying like you need to like do it for 90%, but some people it's going to click you. But at the same time, it's we can't assure that it's going to happen for you also, because we don't know that maybe in that the subject we are studying, like 11 subjects, 12 subjects, you need to be very strong.
Hmm.
Uh, Without like just reading, like I think it's not going to help. I think just even if you, I'm not saying like 90% you need to be thorough. I think like most of people can't
Nobody
able
can be.
to
Nobody can be.
yeah,
Hmm.
it's so vast. It's like medicine is like so vast, MBBS, like, but just to go through like once what's there, what's the concept, like even if you don't have the clear concept also, just to know what's there in the subject, why the subject is there. Like I can see some people are like in like dermatology, psychiatry, they are leaving why to 5 marks, like 4 marks only, why to take the chemistry. But
Hmm.
what I'm saying is, like just to sit for one day, even 5 marks is also going to help. Like you need to ask the value of 5 marks, the people who got 144, 145,
Right,
149,
right, right.
played a very big role for
Few
6 months.
students of mine, they have got 146, 145,
It's
148.
very
So
it's
they
very
know the
discouraging.
value of that. They know the value of
Yeah,
that.
like even I also sometimes even I also thought to why to take more stress on these subjects, but I think more stress, but it's good, it's worth to take it. Like just sit for one day, like just to go through the dermatology, even it's a dermatology, it's a psychiatry, just to go
Hmm.
through one why it's there. Just
You
to
can't
go
leave.
maybe.
At least, at
Yeah, you
least have
can't.
an idea of the PYQs, PYTs at least. You can't
Yeah,
go that I have not done this subject. I suppose
yeah.
that should be. What about microbiology? Like people used to say that, okay, we'll leave microbiology. Is it
Yeah,
fair
sir,
to?
even I also like when I'm seeing microbiology, I'm running out of microbiology. Oh, microbiology, I can't do it. But still, like 10 days before exam, I thought no, I think we should not leave any subjects. I think microbiology is also going to play a very big role, because
Hmm.
microbiology is not only microbiology; it's going to come in ENT, it's going to come in pediatrics, it's going to come in some other subjects. We know like all the disease
Integrated
and
with a lot of things, na? Like
yeah.
infectious
So even
diseases, everything is all about this. Hmm.
yeah, even if you study some things, it's going to help in some other subjects. We don't know it's going to help in microbiology or not, but it's going to help in some other subjects. And I
True,
did
true.
microbiology. I just I said myself, no, this time we are not going to run. We need to sit and we need to see, because every people are studying microbiology, and microbiology is one of the important subject. It's a scoring
Right.
subject.
And it
So
helped,
I
huh?
thought yes, and I thought and sit and studied, and I able to score good marks only, sir.
Oh, so this is
Microbiology,
what
it's
we
helped
do
me.
micro now. If you read it, you will able to solve up much of your questions also.
Yeah,
Okay.
sir.
If you don't, then you don't know about it. Simple.
Yeah,
So
sir.
maximum yielding subject, one of the maximum yielding subject is this, that if you give the time, it will not like ditch you in the exam for sure. You will
Yeah,
able
sir.
to answer most of them straightforwards, or any clinical integration if it is all, you will able to solve up. I suppose so. So tell about those clinical ones, like how you handle up the medicine, how you handle up the surgery, like how much time you have given to them. What about gynae? How much test you have given up? Like
Yeah,
what
sir.
when you have started up the giving the grand test and all this you try to tell.
Yes, sir. Thank you. Like we know, like the big four subjects, right? Gyna, medicine, and surgery, and PSM. Like I think, like some people will say we need to leave medicine because medicine is so vast. But yeah,
Hmm.
medicine is so vast, like everyone knows. But still, you need to study medicine, because medicine, like it will like integrated with all the subjects.
True.
So even I know so many people like they left medicine. We can't do medicine. But I think the four subjects, big four subjects, you need to do it in anyhow, because it's only going to decide you are going to get, like
Hmm.
all of the subjects going to help you in the way that you are going to pass. But I think these four subjects you need to be like, I can't say like you be like clear, like crystal clear, but you should at least know what's there, why it's there. And for main subject, I gave so much of I try to understand what's the concept there. Even for me also, like for first time studying medicine is so like difficult. Like for studying cardiology and all, I'm so much of difficult. Like why pulses, so many pulses, so many of
Mhm. Mhm.
this one thing murmurs and all. But still I sit and I was saying myself, whatever we
Mhm.
need to do it, however we need to do it, like that. Then I sit and I understand why it's there, like how it's happening. So like that, I think for everyone who is now who's going to do and who can't able to do this time, I say just go through once 19 subjects. Don't leave any subjects.
Tell
Everything,
me,
everything.
tell me one thing, Divakar. Like medicine, some says they get into so deep in this that they give 2 months to that. Is it advisable to give up so much of time to a single subject?
No, I think it's no like in six like in like couple of 4 to 5 months we need to cover 90 subjects. I won't say like you need to give so much of time for one subject, but you need to give some time. Like for main subject, at least you need to give like for the first time you're reading, you should at least give like 5 days, like 7 days, 10 days for the first time. But later and all, the first time also you should understand, because once you are reading, you should not tell, okay, next time we will do not like that. First time also you should understand the concept. Next time when you are reading, you should know the concept, like, oh, this something next will happen coming like this, like that.
Your
But
your
that
friends
time,
must be there, na, like who have given up one month to the medicine and all.
yeah,
So
sir, yes, sir.
that, I think from my side also it's not advisable to give so much of time because revision is rather important.
Yes,
Uh,
sir.
Giving up time to a particular one first time, okay, when you are in the like final year and all that, if you have started up the studies that time, it's good. You can give 1 or 2 months also, but now
Yeah,
you can't give 1 month to a single subject. Now, in the last, I like to ask up regarding the GTs and all. What about the test and all? What you have done about them? Because it is very mandatory. People
yeah,
used to
sir.
run.
Yeah, revision is mandatory, but at the same time, giving GT is very, very mandatory, because some people are saying like we can't able to complete all subjects. I can't give GT. I will give GT on the day before exam, like 10 days before exam. But my advice is like for the first time, even if you have some time, like even if you 10 subjects, 15 subjects, just to give it once, just know the pattern of exam. You need to first sit for the 5 hours. You need to train your body to sit for 5 hours, because even for me also, for the first time, I will get like bored. I can't able to sit for so much of time in the screen.
Mm.
I will get, we need to go fast. We need to go fast. First, you need to get practice for that thing. And giving GT is also important, but analyzing GT is so much of important, I will say, for
This is
each
the
and
crux.
everyone.
Analyzing GT is the crux.
Like,
Several students they give the GT, but they don't analyze it. Which
yeah,
particular thing they made wrong. So
like
tell me
mostly,
something about the 20th notebook also, which you were telling before. 20th notebook you
yeah,
have made. What?
yeah, sir, for all subjects, like, not like I can't take each and every notes from all subjects, but the thing which I'm getting so much of, like frequently I'm getting wrong. And I
Right.
think this concept and all we need to, this concept we need to see once before the exam, like, however we are going to forget. So these things we need to see 1 or 2 days before exam, so that it will be stick to our mind. So those
Hmm.
type of things only I wrote it on my notebook, 20th notebook, sir. So before exam for 4 days, I studied the only the 20th notebook. I just revised the.
Tell me about the last week before the exam. What you have done in the last week before the exam. This is last of the questions. Not
Yeah,
bother you much about
yeah,
this.
not like it was so crucial for me. Like each and everyone, like who were going to give that exam at that time. For me also, it was so overwhelming and like so vast. How we are going to do, like while preparing, it's not like that much. But while the exam is reaching us, it's like getting so much of pressure. How we are going to do? What
True,
if
true.
it's not this time? What will go? What will happen? Like how, like how the questions are going to come, like that. Even for me also, same thing happened. Like so much of pressure, so much of thing. But still, okay, however we came this far, like for 6 years we came this far, we are not going to change anything, but we can do something to do something for the exam. So I did that. I just revised the 20th notebook, and I watched some random YouTube videos for the images section and one liners to rapid revision. That's all. And microbiology also I did it.
Images you focused, huh? Images you focused.
Yeah, the images I focused. Images played a very big role. Even
Okay.
sometimes if you don't know the answer, but if you know the images also, you can able to get, oh, this will be the answer, like that. Sometimes some questions it will help, sir, for images.
So a lot of takeaways from this particular interview, guys. If you have not made your 20th notebook, do make that. And very best of luck from my side. Best wishes, Dr. Divakar. Enjoy
Thank you. Thank you,
and
sir.
thank you so much. Okay.
Thank you, sir.
Be in touch. See you.